Most people think that strokes only occur in older adults. 20-year-olds, they don't really think about the possibility of having a stroke. We asked neurosurgeon Dr. Joshua Marcus to weigh in with his 22-year-old patient, Sawyer. They both join us now via Skype. And I thank you both so much for being here. I think this highlights something that's so important because you don't know what you don't know. And Dr. Marcus, you see strokes occur in these very young people that you wouldn't even think are at risk. Tell us about that.
There are studies that show that strokes are certainly on the rise in patients 18 to 44, women more than men, but we are seeing strokes increasing in young patients for a variety of reasons.
Sawyer, walk us through what happened to you.
So essentially, it was a normal day. Then at about 12:30, completely out of nowhere, it was snap of the fingers. And I just couldn't feel my right arm, completely couldn't feel my right arm. I think I was, and it was clenched, totally clenched, like right here. And I had to like physically unclench my own fingers like that. And from there, I realized that I couldn't feel my right leg either. And so I was getting very lightheaded. It was almost sort of like a part of my brain had short-circuited in a way. And so my natural instinct was just to lie down. An hour or two later, my mom came home and she jarred me awake. And after she did that, I had this very panicked look on my face. And she asked me, "What's wrong, Sawyer? What's wrong?" And I could tell something's wrong. And I was trying to speak to her and I couldn't. I could not say a word. I was essentially doing that with my face. And my mom, thank goodness, is stroke aware, actually. My grandfather, her dad, had a stroke when he was about 70. And because of that, she decided to do her own research on the subject and get more stroke aware.
She knew some of the warning signs, and even though obviously you're not a typical stroke victim, she knew to be afraid. And the reason that we wanted to do this segment is because, Sawyer, you now know in retrospect, the last thing that you should have done is just gone to sleep.
Absolutely.
Because, and this is the key, time is brain.
Yeah.
When it comes to a stroke, no matter the cause of that stroke, time is brain. And if you just go to sleep and you fall asleep for 8 hours, the damage will be done. Dr. Marcus, you were Sawyer's doctor. And even you see a 20-some-year-old with these acute symptoms. That's not the typical presenting age. You used a groundbreaking procedure to basically allow Sawyer to live his life the way we're seeing him now. Tell us about that.
So the procedure I performed is called a mechanical thrombectomy. In this procedure, we're able to access the femoral artery, which is an artery in the groin, and using a series of sophisticated catheters and X-ray guidance, we can guide those catheters all the way up in through the neck and up into the brain to physically remove that clot. We use an aspiration system to extract that clot right out of his blood vessel. And we were able to instantaneously restore blood to that half of his brain.
And Dr. Marcus, not too dissimilar what we do to the heart when in fact we have a thrombus, we have a clot in the heart blocking those key vessels. But I think it's so important everybody understands not all strokes are created equal.
You're right, not all strokes are created equal. I think the important things are that time is brain, that every second the brain is without blood and oxygen and nutrients, about 1.9 million brain cells are dying. And these cells are different than heart muscle or skin or other tissue in the rest of our body. The brain does not regenerate. And so once that tissue is dead, it is damaged irreversibly forever. And it depends on which blood vessel is affected as to what the long-term neurologic outcomes are going to look like. For some people, it's inability to speak. For some people, it's inability to move. Some people, it's dizziness. Some people, it's vomiting. And all of these signs are very important for recognizing a stroke.